తేడా లేదు.
Due to the disease, government has regularly been requesting Indian nationals on hand and respiratory hygiene, environmental sanitation measures like routine cleaning of frequently used surfaces, minimizing the sharing of objects, and ensuring appropriate ventilation besides social distancing. In continuation of the already issued advisories, Department of Personnel and Training has issued orders to reduce the contact and congestion in government offices. These include allowing Group C and D employees to attend offices on alternate weeks and staggered timings for Group A and B employees. States shall issue instructions for regulating hours in the services except for essential services. Industrial establishments to consider staggered timings and regulation of crowd in market should also be resorted to. States shall issue directions to private sector to consider work from home wherever feasible. All educational institutions, theatres, museums, gyms, exam center, etc. shall be closed temporarily. States shall take necessary action to ensure that all sporting events, competitions and religious gatherings shall be postponed, and it shall be ensured that required social distancing is maintained even in smaller gatherings. With respect to public transport, it is directed that metros, railways, buses and airplanes shall consider decrease in frequency of their services, alternate seating to ensure social distancing. Effective disinfection and crowd management be ensured in places like railway stations, metro stations, bus stands and airports. Railways have issued orders wherein travel concession for senior citizens and all others availing concessional booking except for patients, students and Divyangan category since 000 hours of 20th March, that is today midnight onwards, have been temporarily suspended. Further, in order to protect the most vulnerable of our population, all states shall issue appropriate instructions wherein all citizens above 65 years, except for public representatives, government servants, medical professionals, should be advised to remain at home and avoid gatherings except for medical reasons and need for essential services. Similarly, all children below 10 years of age should be advised to remain at home and avoid going to public parks, picnics, and other games requiring large number of participants. In consultation with medical professionals, detailed advisory is being issued for all health establishments to avoid non-urgent hospitalization and minimize elective surgeries. This is being done to avoid hospital-related infections to the vulnerable and prepare hospitals for meeting challenges posed by COVID-19. Youth and citizens are urged to become volunteers to support government's ongoing efforts in management of COVID-19. Ministry of Pharma and Consumer Affairs to take necessary action against anyone charging exorbitant prices for masks, sanitizers, and other health-related logistic material, and also to facilitate their availability in all hospitals and to people at large. They also directed that people should be sensitized on appropriate use of masks, to be utilized only when needed, and to wash hands with soap. It was emphasized that communities should be aware of all the steps taken by government and to solicit their support in government's efforts for managing COVID-19 disease. Thank you.
Friends, now
government's efforts on aviation side, I would like to inform you that yesterday 201 Indians were evacuated from Iran. They included both pilgrims and the students studying there. They were all transferred by Air India flight to Jaisalmer, where they were stationed, they were based in our quarantine, which is an army center there. Another information I would like to share with you is, on 21st March, that is Sunday, Air India would be mounting one 787 Dreamliner for Rome to evacuate our students, other travelers, or any Indians stranded there. This Dreamliner has a capacity of 236 seats, and we are in close touch with our mission there to work out on the remaining modalities so that we can bring back our stranded Indians to our country. This flight would take off on 21st and would return on 22nd morning. Thank you.
Now we can take the questions. 154.
I just want to know, sir, I think involved for testing. Conditions to change those conditions to scale it up. What is the government waiting for? What will make it necessary? How big or wide or deep does it have to get for those conditions to be changed?
See, yesterday also, already I think details were given and continuously we are briefing. There is a particular set definition how and when sample has to be taken. It is important to understand that we should not just take sample because, we feel comfortable. The incubation period of the virus could be from 2 to 14 days. So if I just get tested today and tomorrow I am in touch with such other people or I am asymptomatic today, I can still be tested positive tomorrow. So that is why testing probably will not serve the purpose. Experts have sat together, public health specialists have sat together, and based on that they have come up with this thought process, this clear defined guidelines based on which you should have a travel history and if you should have a contact with such travel history and you are symptomatic, then the sample should be taken. Similarly, if you have a contact history with a person who is positive and you are falling within that criteria in terms of primary contact and you are showing symptoms, then only the sample should be taken.
57. I think this clarification, other details, let the next question be there from 57. Yeah.
Sir, the press release mentions that commercial aircraft from any foreign country will not land in India after March 22nd. And you just said from the midnight falling between March 20th and 21st. So could you clarify? And second, any evidence of community transmission yet?
In India, there is no evidence of community transmission as of yet. There has been a major effort in terms of taking the required preventive steps, ensuring cluster containment strategies are put in place so that community transmission do not take place. And this is a very conscious and sincere effort being done by government. With respect to the airlines which you mentioned, let me highlight that these guidelines, the temporary restrictions which are there, they will be in place from midnight falling between 21st and 22nd March.
152.
Sir, what is the
Use mic, please.
What is the latest figure of casualties due to COVID-19, and is there any possibility of community transmission due to COVID-19?
See, the conscious effort of government in collaboration again with community has always been to see that case number does not increase. With respect to ensuring that if we have even some cases, travel related cases, linked with some immediate family members and contact they've infected, we have been able to trace all of them. All these people get traced, they get monitored. There is no community transmission in this country as on today. And we expect to really work hard, take support of community at large to ensure that we remain that way. I'll also, just to bring to your kind notice, we had one more death reported, total 4 deaths reported as on today. The issue in this case also has been that this person was an elderly person having comorbid conditions of diabetes and cardiac patient also, as well as he was a hypertensive. So this was the 4th reported death case which has been reported today.
31.
Sir, my question is that ICMR and Health Ministry have already said that we are engaging with private labs on testing. When will the private labs begin testing? What is taking them longer? And what will be the test modality? ICMR has made it clear.